So moving forward in the main degenerative spine, in that we are discussing about the cervical region, which also applies to the thoracic, lumbar, and all the segments otherwise. In this, we discussed about the risk factors. Risk factors આપણે પહેલા discuss કરેલા, and now we are moving to the next, that is the symptoms. Symptoms, what the patient will complain of, and later on we are going to see the signs, what we check for in the patient. So the first thing in symptoms is of course pain. Yes, symptoms vary depending on the location of the herniation and types of tissue, soft tissues that become involved. Kaya soft tissue involved થાય છે? If it is only the cervical spine, it is even just the IV disc or the vertebra itself have been fractured, as we talked about in the last lecture. સ્પાઇનલ કોર્ડ ઇન્જરી થઈ શકે, સાથે ફ્રેક્ચર્સ હોઈ શકે, લિગામેન્ટ ટેર હોઈ શકે, અને સાથે આઈવી ડિસ્ક પ્રોલેપ્સ ઓર હર્નિએશન થયું હોય. બધી કન્ડિશન્સ માંથી કયા સોફ્ટ ટિશ્યુઝ અફેક્ટ થયા છે, depending on that there will be signs and symptoms. They can range from little or no pain if the disc is the only tissue injured to severe and unrelating neck pain that will radiate through the region served by the affected nerve roots that are irradiated or impinged by the herniated material. એટલે ઘણીવાર એવું થશે કે પેશન્ટને સ્લાઇટ અમાઉન્ટ ઓફ પેન હશે, યસ, લોકલાઇઝડ પેન, જે પણ સેગમેન્ટ અફેક્ટ હશે ડિપેન્ડિંગ ઓન ધેટ. અને ઘણીવાર એવું હશે કે આખા હાથમાં ટિંગલિંગ, નમનેસ, પેરેસ્થેસિયા ટાઈપ્સ ઓફ સેન્સેશન્સ હશે, and the patient will complain considerably that the movement is also lost. Yes, so motor and sensory બંને affect થઈ શકે, or only sensory to a small limit. A wide range of signs and symptoms will be present depending on the site and depending on the structures involved. Two most common levels in the cervical spine to herniate are C6, C7, as we already talked about. આપણે MRI જોયો એમાં પણ. And C5, C6 level, and the C7, T1 is least common. In thoracic, all the segments are equally prone to get symptoms, and in lumbar, L3, L4, and L4, L5 are the most segments where herniation is possible. Yes, so the symptom may be little with no pain, and maximum amount of pain that is so severe that there is paresthesia, even type of signs and symptoms. Clinically, the patient will present with various things. So first, due to the mechanical compression of the cervical nerve root, that is radiculopathy, કોઈ પણ એક nerve, sensory specifically, if gets compressed, તો શું થશે? આગળ આખામાં tingling, numbness type of sensation થશે along the whole distribution of the nerve. Yes, that is why dermatoma is important. So first, the patient will complain of neck pain. Second, arm pain, જ્યાં પણ radiate થતું હશે, specifically cervical region ની વાત કરી તો arm pain, lumbar region ની વાત કરી તો there will be even back pain and even the lower limb pain. Sensory disturbances, numbness or tingling in the distribution of the dermatome affected. Yes, so as we talked about akha distribution, the nerve no distribution છે એમાં આખામાં, it will get affected. The nerve that is affected by the cervical disc herniation is the one exiting the spine at that level. So if C5, C6 level is there, so as we talked about, C5, C6 છે તો હંમેશા નીચેનું આવશે. C6 spinal root will be affected. Yes, C1 to C6, and from C7 it will be lower one. Yes. Physical examination. Now these are few tests that you can perform specifically for cervical spine, and there are other neuro tests that you can perform that you are going to learn in spondylosis, in muscular part, how to perform specific test. Yes, so these 5 tests that we are going to see are simple ones, are something that you can logically think of why there is initiation or increase in pain. So if pain originates from the disc but there is no nerve root involvement, there will be normal neurological examination. આખું neuro examination આપણે જ્યારે કરશું, starts with higher mental function, starts with consciousness level, sensory, motor, reflexes, Babinski sign, everything. If we include reflexes, everything, these all things will be normal. બધું જ normal આવશે. શું કામ? કે કોઈને pain નથી, patient ને pain નથી કોઈ પણ એક જગ્યાએ. Yes, but if there is pain and nerve root compressed થાય છે specifically, then there will be signs. First, sign of radiculopathy on examination. First is limitation of neck extension. જ્યારે પણ neck extension કરે patient. Yes, so what is the normal tendency? Vertebrae છે એ extension માં જશે, spinal cord વધારે compress થશે. Spinal cord વધારે compress થશે, signs વધારે આવશે, or symptoms increase થશે. Yes, pain increase થઈ જશે. એટલે patient કોઈ દિવસ neck extension નહીં કરવા દે. Second, downward head compression increases patient's radicular pain and paresthesia. So more and more compression, keeping the head here and passively, પાછળ therapist હોય, you can see, and compressing it, moving the vertebrae together, તો શું થશે? પાછું compression વધશે. Yes, IV disc or બે vertebra વચ્ચે જે disc ની space છે એ પાછી reduce થશે compression થી. You are trying to compress it down. એનાથી સાઇન એન્ડ સિમ્પટમ ઇન્ક્રીઝ થશે. Third, shoulder abduction relief test, significant relief of arm when the shoulder is abducted. Yes, shoulder abduction જ્યારે પણ patient કરશે તો patient ને relief લાગશે. Why? Because the muscles that are supporting this, specifically upper trapezius muscle and the scaleni and other muscles, when they are under tension, એ અહીંયા support નહીં આપી શકે cervical spine. Instead, they are in tension. When you go for abduction, this becomes shortened position. Right? Shortened position આવી જશે muscles ની, and that is why they can provide more stability to the spine and reduce the symptom. That is the main mechanism why abduction will relieve the main signs. Next is Sperling sign, that is gentle neck hyperextension with the head tilted on the affected side. Say for example, this is the affected side. So at time patient ne increase thase. Why? The pedicles again of the spine, extension અને compression, જે બાજુ already compressed છે એને તમે extension માં એટલે space decrease કરી એની બાજુ compress કરો છો તો શું થશે? Increase થશે symptoms. Will exacerbate the symptoms or produce radiculopathy. એટલે આખા નવના કોર્સમાં radiculopathy ચાલુ થઈ જશે, આખા હાથમાં radiating pain ચાલુ થઈ જશે, આખા કોર્સમાં pain feel થશે patient ને. And fifth, upper limb weakness, paresthesia and dermatomal sensory deficit, changes on reflexes can occur. Yes, which are the changes we are going to see specifically for cervical spine, because that is the most common region for the degenerative spine disorders. So upper limb ma weakness ave, motors affect thase, paresthesia burning type of sensation patient feels, dermatomal sensory deficit, je dermatome affect thya che ema sensory deficits patient ne feel thava mande, and changes to reflexes can also happen depending on the myotome. Yes, if biceps is affected, then C5, C6 will be affected. Lower segments will not be affected. Depending on which segment it is, there will be signs and symptoms. Okay, so these are the few features associated, thoda features associated with cervical spine, more of radiculopathy. So sensory kayu che, motor kayu che, and which are the reflexes that can get affected. All the things have been described. So first, C5, shoulder abduction and flexion, muscle weakness, myotomes are affected. So shoulder abduction and flexion with elbow flexion, these will be affected. Reflexes affected will be biceps, sensory on the lateral aspect of the arm. C6, elbow flexion and wrist extension, biceps and supinator reflex will be diminished. Yes, almost diminished. It will never get exaggerated. Why? It is peripheral nerve that is getting involved. Yes, nerve originate થઈ જાય છે spine માંથી, પછી compress થાય છે. It is always lower motor neuron type, never upper motor neuron type. Lower motor neuron માં હંમેશા hyporeflexia આવે, hyper ના આવે. Sensory changes, lateral forearm, thumb and index finger. Yes, so lateral aspect of the forearm, thumb and index finger, these will be affected if C6 is affected. Depending on these, if you remember dermatome and myotome, no need to remember this table. Yes, directly from the figure itself you can make it out which are the dermatomes, which are the myotomes, and from them you can say which muscle is affected, which part of the sensory supply is affected. You can just write it yourself, but one or two examples in the exam you are supposed to write at which segment what changes can happen, kaya changes kaya level affect થાય તો આવી શકે, that you need to write in exam. C7, elbow extension, wrist flexion and finger extension, triceps reflex will diminish, hyporeflexia, and sensory changes specifically in the middle region, middle finger. C8, finger flexion, none reflex will not be affected, any reflex. Medial side, lower forearm, ring and little finger will be affected. T1, finger abduction and adduction, none reflex changes, and medial side, upper forearm and lower arm will be affected. So that is what is the affection. Sensory level changes also we have discussed. So this all depends on dermatome and myotome. No need to remember the table if you remember the chart. Now sign of myelopathy. Yes, cervical myelopathy. Yes, compression in the caudal posterior direction directly or the central cord is affected. At that time, what will be the signs and symptoms? So the first thing, increase upper and lower limb reflexes or other motor neuron signs suggest myelopathy. Most of the times we are going to see whenever we are providing or an injury happens at the cervical cord itself, centrally શું place છે cervical cord, posteriorly કોઈ પણ disc bulge થાય, annulus બહાર જશે, yes, nucleus ની બહાર જશે, and that directly leads to what? Compression of the spinal cord. Once the spinal cord is compressed, એકવાર compressed થઈ ગઈ તો UMN type sign and symptoms આવશે, and lower segments માં પણ same effect can be seen. Yes. So upper and lower limb reflexes will get exaggerated, hyperreflexia, because it is UMN type lesion. Upper motor neuron sign includes weakness, spasticity, hyperreflexia, positive Babinski, that is plantar reflex, clonus, positive Hoffman reflex. We have talked about the Hoffman reflex, just extending the posterior phalanx, distal phalanx, and seeing the reflex. Cervical spine lesion can produce quadriplegia. Yes, directly spinal cord માં જો posteriorly વયું જશે, central cord compressed થશે, spinal cord compressed થશે, that will lead to what? Myelopathy, cervical myelopathy. Urgent evaluation and action are needed. If not, it will be a permanent disabling condition. So time reta within 30 to 45 minutes, if the patient is reaching to the hospital, is going for decompression, that is fine. Some changes of course will be there, but permanent loss will not be there of the whole body. Here there will be permanent loss. Yes, after this 1 hour or 2 hours of duration. Yes, so if this happens, it is very disabling for the patient, and the patient will not be able to again use their upper limb and lower limb, that is quadriplegia will result. Diagnosis. Coming to diagnosis. So what is the first thing that you take? History. Yes, patient ni history. એમાંથી ખબર પડશે કયા symptoms ક્યારે start થયા. Yes. Second, physical examination, the special test that you will learn in musculoskeletal and other things. Also, imaginary confirmation of with MRI. We talked about the MRI in the last section, in the last lecture, that if there are changes, you can specially see which are the changes that can be easily assessed in that part. Yes, say for example, cervical C3, C4 છે and herniation has completely occurred. Yes, sequestration થઈ ગયું છે. That will be, then you can see and correlate clinically કે patient ને કયા sign and symptoms છે, and clinically MRI through તમને દેખાશે imagining that if that segment is affected or not, or is there anything else you need to take care, or what will be the progression of the disease. Everything you can decide from the MRI. Investigation, X-ray, CT scan, okay, MRI and EMG NCV studies. EMG NCV શું કામ? Electromyography. Yes, study of a muscle through a specialized instrument. Yes, so muscle માં શું changes છે એ ખબર પડશે later stages માં, જ્યારે now completely compressed હશે at the cervical root, weakness આવી જશે. Yes, UMN type of sign and symptom will be there. So weakness આવી જશે. Weakness ના લીધે, yes, the patient might think, or the patient might have changes in the muscle. Yes, also nerve conduction velocity. જ્યારે પણ કોઈ nerve compress થાય તો normal જે signals જતા હોય at 50 to 60 meters per second ની speed થી એ decrease થઈ જશે. Yes, highway મોટું હોય એના કરતા નાનું થઈ જાય તો speed હોય vehicles ની decrease થઈ જાય. Think of a 6 lane. Yes, એમાં 80-90 ની speed ઉપર જતા હોય, જ્યારે એ 3 lane કે 2 lane થઈ જાય તો શું થશે? એ speed બધાની overall બધા you can say cars ni or બધા signals ni decrease થઈ જશે. Yes, so nerve conduction velocity also decreases. Nerve conduction velocity, a specific impulse કેટલા speed થી travel કરે છે nerve માં, ચેતાતંતુમાં, that is nerve conduction velocity, that also decreases because of compression. X-rays will tell you, plain cervical X-ray radiograph evaluate the chronic degenerative changes but can't show herniation. એ normal disc ની જે સ્પેસ છે or બે વર્ટિબ્રા વચ્ચે જે સ્પેસ છે એ તમને કહી શકશે કે રિડ્યુસ છે, ઇન્ક્રીઝ છે or what, but it cannot show the disc, it cannot show how much it has moved out, or it is normal or abnormal. Disc ને imagine ના કરી શકે. X-rays are limited to bones. CT scan, axial computed tomography, scan demonstrating right posterolateral protrusion. So here you can see the disc is moving in the right direction, in the right posterolateral, posteriorly and laterally it is moving. Yes, so that can be easily assessed. MRI on the other hand is very specific. It can show very specific details of the annulus and the nucleus both. Yes, so the single best test to diagnose a herniated disc is MRI, gold standard. Always use MRIs. MRI can imagine any nerve root pinching caused by the herniated cervical disc. So here you can see directly, you can see from here what is the size. It can give you dimension also, કેટલી reduce થઈ ગઈ છે, normal size શું છે, કેટલું reduce થઈ ગયું છે, and also it can show very easily which part is affected, how much it is affected. You can see it has moved posteriorly, and specifically it has reached almost, you can say 20 to 30% it has moved into the spinal cord region. So if it increases with time All things you can find very easily, very clearly through MRI. EMG NCV, so no need to go in that much detail. Just remember the last line. These tests can detect nerve damage and muscle weakness. Muscle weak થઈ જશે એટલે એના ઇલેક્ટ્રિકલ સ્ટડીઝ જે આપણે કરવાના છે ઇન EMG, that we can find એના કન્ક્લુઝનમાં આપણે આટલું જ કહી શકીએ કે મસલ વીક છે, નથી વીક, અફેક્ટેડ છે, નથી અફેક્ટેડ. And now velocities as we described, highway, example of highway, yes, if it is 6 lane, if it is 2 lane, એના ઉપરથી ખબર પડશે if the car will move fast or slow, એટલે impulse fast જશે કે slow જશે. So that is very clear to us that nerve will get damaged, so nerve conduction velocity NCV will decrease. Treatment, non-surgical and surgical. Yes, so non-surgical is what? Self-care, rest, medication, physical therapy, bracing, cervical traction, still part of physical therapy, and surgical also. In non-surgical, the first step is to diagnose very clearly. પહેલા તો એ જ ખબર હોવી જોઈએ કે diagnosis clear છે કે નહીં. MRI clear છે, these are the signs and symptoms clinically correlating, and then go for treatment part. So conservation, non-treatment, non-surgical treatment is the first step to recovery. Most cases of cervical pain do not require surgery and are most treated using non-surgical methods. In most cases, pain from herniated disc will get better within a couple of days and completely resolve in 4 to 6 weeks. જ્યારે પણ medication and physical therapy, if these both are done together at a point, it will help relieve the symptoms much more better way compared to others. Yes, એક ખાલી medication, એક ખાલી physical therapy લેશે will not be that much effective. Both done together, within 2 or 3 days, patient can feel the pain is start decreased, and in 4 to 6 weeks, that is in 1 to 2 months, you can say maximum, all the pain from the source has moved out. So which are the medications we use? The first is non-steroidal anti-inflammatory drugs such as aspirin, used to reduce the inflammation and relieve the pain. Second, analgesics such as acetaminophen, relieve the pain but doesn't have the anti-inflammatory effects of NSAID. Muscle relaxant such as methocarbamol, prescribed to control the muscle spasm if the muscles have gone for spasm. જ્યારે પણ cervical spine or any part of the spine is affected, surrounding structures માં પણ changes આવશે. Yes, IV disc move થશે બહાર, nerve compress થશે, એના લીધે જે muscles છે surrounding paravertebral muscles, even the thoracic muscles and abdominal muscles, they will all become spastic. They will all go for spasm. Yes, why? Because they have to maintain the position. જે પણ vertebral columns ની main છે, that is longitudinal and other ligaments. Also, these other ligaments, they are supported by these muscles. Muscles નું કામ શું છે? Erector spinae. What is the main muscle? It is the stabilizing muscle, core muscle. જો core muscle is affected, at that time, the whole structure of the spine gets altered. Yes, it gets diminished. And because of this, there are chances that the muscle will be in spasm. Whenever you see back pain patients and a spasm, તમે palpate કરવાની try કરશો paravertebral muscles માં 100% you will be able to palpate the spasm. એ વધારે tension માં હોય muscles. Yes, because they are working more to normalize the part. Yes, it is the self healing mechanism of the body. So we also need to relax the muscles with this. Yes. So steroids may be prescribed to reduce the swelling and inflammation, taken orally to tapering dose over a 5-day period. Yes. Steroids not too frequently prescribed, but can be given to the patients. And steroid injection in the area of herniated disc may perform the pain if severe. Paresthesia type of pain, completely unbearable pain, then and then such injections are indicated, otherwise they are not indicated. Bracing and cervical traction. Bracing, orthosis, something that you learn in 6th semester. So cervical spine can be given hard collars, soft collars, all things are possible. Yes, so depending on what is needed for that patient, you will be deciding. Physical therapist, you will decide કે આમને શું prescribe કરવું જોઈએ, and orthotic will make it and give it to the patient. Also, cervical traction, which is again part of physical therapy, you already have learned, can be given. That will increase the intervertebral disc space, or you can say the distance between the two vertebrae, and that will again relieve the symptoms. Surgical treatments. Now, surgical treatment, they are not that much indicated unless and until the symptoms are severe. If the symptoms are severe, even if the steroidal injections are not working, then only surgery is indicated. So, for patient whose pain doesn't improve with the neurological treatment, continuing severe arm pain for more than 6 months without benefit from conservative pain or conservative therapy, ક્રોનિક ઓર રિલેપ્સિંગ આર્મ પેન. એટલે આના ઇન્ડિકેશન શું છે, ક્યારે પેશન્ટને સર્જરીનું કહેવાનું કે 6 મંથ સુધી આપણે બધી ટ્રીટમેન્ટ કરી, મેડિકેશન એન્ડ ફિઝિકલ થેરાપી, સ્ટીલ it is no improvement, પેશન્ટને એક પણ ટકો ઇમ્પ્રુવમેન્ટ નથી, then yes, in surgery is indicated. Second, chronic pain હોય, more than 2-3 months થી પેન હોય, અને relapsing type of arm pain. Yes, arm pain because of the cervical compression, એના લીધે arm pain થતું હોય, અને consecutively 1 month આવે, 1 month treatment લેશે, સારું થઈ જશે, પાછું after 1 month or 2 months again the same thing is repeated. So this is the recurrent cycle. Significant weakness in the upper limb that does not resolve with conservative therapy. Myotomes, if they get involved, yes, conservative treatment thi ema fer na pade, weakness rage considerably, then yes, there is indication that the nerve needs to get decompressed surgically. And evidence of central disc prolapse causing cord compression, of course, central disc prolapse hase, myelopathy hase, at that time you are not taking risk, you have to go 100% for the surgical treatment. What is it? Discectomy. Yes, removing a part of a disc, cervical or any intervertebral disc, that is discectomy. The goal of surgery is to remove the portion of the disc that is pushing or the compressing the nerve. જે nerve compress કરે છે એનો એક part કાઢી નાખવાનો, that is the only treatment. The operation or surgical procedure is termed as discectomy. Yes, so this is the only surgery that is possible in the cervical spine, decompression. Indication: progressive neurological deficit, myelopathy or radiculopathy that causes functional disability, patient ne disable કરી દે, motor function specifically affect કરશે. Severe pain that does not respond to analgesic, and chronic or recurrent pain, all the things we already described. Yes, then only surgical treatment is needed, otherwise not needed. Yes, with this we completed the degenerative spine. So degenerative spine is a very frequent condition, mainly affecting the cervical region and then the lumbar. Thoracic is not that much affected. In that we saw the risk factors, we also saw the indications for the treatment, we saw the assessment, we saw the treatment. Yes, and two important conditions in which it is divided. One is disc herniation and second is spondylosis. Yes, that is the breakdown of the whole vertebrae in the cervical region that will lead to the changes because of the age. એના લીધે ખબર પડશે, or એનાથી affect થશે what? The space between the two vertebrae governed by the IV disc. IV disc ma compression avse, 4 stages. Because of these stages, depending on how much the disc is herniated, nucleus has come out of the annulus, there will be signs and symptoms. And now એના ઉપરથી આપણે કહી શકશું if the patient will need physical therapy and medications together always. Yes, okay. Any doubt so far?